Hi guys, I want to introduce myself. My name is Julie Walls and I'm a brain retrainer. I've been brain retraining since probably about summer of 2017. I'll give you a little bit of a backstory on myself because I get a lot of people asking me, well, how did you stumble upon the brain retraining and why are you utilizing brain retraining programs? Why are you doing these brain retraining programs? And I'll just explain to you a bit. I had my son, my firstborn, in 2007, and I started developing severe back of the head headaches after his birth. I had a traumatic pregnancy. I was, on bed rest for many months. I was in the hospital for about a month before I had him. It was a rough journey. But before that, I immediately I got married. I then quit my job because of the constraints that I had with my pregnancy, the issues that I had with my pregnancy, and I just became a stay-at-home mom basically from the get-go. And I really didn't think about the impact of that stress and then dealing with such a complicated pregnancy. And I noticed after I gave birth to my son, I started getting these headaches. And I thought it was a structural issue, so I was seeing chiropractors, and I had gone to the doctor about, addressing the migraines and things like that. And I just kept moving forward and, just thought, well, it's just what I have to deal with. Maybe there's some sort of a hormonal imbalance that's going to balance itself out. And then I had my second boy, still continued with headache issues. And then I had my daughter. So kind of had kids back to back over a span of about 4 years. And these headaches would come and go, and I really couldn't just pinpoint exactly what was going on with them. But then I started noticing I started having blood pressure issues. And my blood pressure started going up, and I started seeing physicians and specialists and, just trying to figure out chasing this whole blood pressure issue, at 28, 29 to 32 years old. I thought, this is kind of ridiculous. I was athletic. I was working out a lot. I had watched my weight. I pretty much was on top of my health for the most part, eating a real low sodium diet, following these restrictive type hypertension diets and things like that to help myself, but my blood pressure kept going up. And then I was put on anywhere between 2 to 3 different antihypertensive type agents. And, it was just kind of alarming. I really couldn't figure out what was happening here. And then, unfortunately, the headaches still kept coming and the blood pressure, and they didn't know what to do. And they just kind of were like, well, maybe it's just genetics. We don't really know what's going on with you. Well, then after I had my daughter, there was somewhat of an emergency that had happened with her, and that actually kind of was traumatic, and it drew from something that I had dealt with a long time ago in my childhood. I had witnessed my sister's death when I was younger, and she had passed away in the car, and my daughter had gotten sick, and she was sick in the car, so something had triggered in my brain. In about, 2011, 2012, I started noticing I didn't feel good. After dealing with her issue, and we had to go to the hospital, and she was really sick, and then, we had to work through that, and then I got home, and I started just noticing I wasn't feeling very well. Things just started to kind of go downhill from there. So we started seeing different specialists, went to Mayo twice or 3 times, had a ton of workups on me. I still was having headaches. I was still having, a lot of pain in different places. My knees hurt. My joints started hurting. I was weak. I was tired. I was fatigued. And then I stumbled upon a chiropractor who had a couple people in his office that actually, he diagnosed them with Lyme disease. And he was like, I think you have Lyme disease. And I was like, what is that? Like, I didn't even really understand what it was. And I had some issues with my eyes. And at one point, my vision went out. And I had to go to the hospital, and I was diagnosed. I saw a team of 8 different neurological professionals and doctors, and went through the whole MS workup. Did everything. They were looking at everything, doing scans on my brain, and I was in the hospital for about a week, and nothing. They said, you just experienced a really bad migraine. And I'm like, I have never had that before. And I started losing weight. I started having some stomach issues. There was really nothing that anybody gave me any concrete information. I was kind of like searching and trying to figure out why I was falling apart. And as soon as I saw this neurological team, one of the best ones in our area, they sent me off to it's a optical specialist who deals with neurological disorders. And he did a full workup on my eyes and the back of my brain, all these things, and said everything looks completely normal. And I'm like, why am I having these vision issues now and all these headaches and everything else? And they were like, he looked at me and he said, well, I'm going to tell you one thing. He said, myself, I had Lyme disease. And he said, it took me a couple years to recover from it. But he also suggested that I get a Lyme test done. And he wrote it down, and he told me the specific test to have. And then he's like, but I can't order that for you. You may have to go to like a functional doctor or a chiropractor. Well, my chiropractor, he had mentioned the Lyme diagnosis to me. And so I went and got a test through him through iGenex, IGENEX. He said that's the best on the market for right now. And my Lyme test came back positive. And so I was like, oh great, I've got Lyme disease. I don't even know what this is. I have no clue. So then I went to go see a Lyme disease specialist, and I started going down that road. And I had no clue what it was all about. I really honestly thought I would only be on some sort of antibiotic for a couple weeks and then be done with it. And then it literally, my whole world crashed after this. They put me on combo antibiotics. Then next thing you know, there was all sorts of other things that were imbalanced, and I was chasing my tail, and I started antibiotic therapy, and it made me deathly sick in 2015. I got down to about 100 pounds, and I kept losing weight like crazy. I couldn't eat. I was basically having like mild seizures, horrific anxiety spells, depression, insomnia. My hair was falling out. I was losing weight rapidly. I was just a mess. I was basically, my organs were shutting down. Everything was just stopping for me, my whole world. I was basically bedbound, bedridden, homebound, couldn't drive, couldn't eat. I started looking into cannabis, and because I knew of cancer patients that had gotten to this point where they were really deathly sick, and the only way that they could eat or get any nutrients in was smoking cannabis and helping their body be able to relax enough to be able to get some nutrients in. So I kind of resorted to that. And then I stumbled upon bee venom therapy. And for those of you that are not familiar with bee venom therapy, it's a process of using live honeybees, and you sting yourself on your spine up to 10 times a day for 3 days a week. So I started that process, and stung myself Monday, Wednesday, and Fridays, and then detoxed in between the days. So I pretty much was just dealing with medical, body stuff every day. Like either I was downing a bunch of supplements, or I was detoxing, or I was stinging myself with bees, or I was taking herbals, or I was doing all these things to try to get this bacterial load down. And I did the bee venom therapy for about 15, 16 months. So I roughly stung myself with over 2,300 bees. I became a beekeeper from it, which is awesome. I got my own hives and just, my own hives, my own bees, and really, really kind of embraced the whole process as best as I could. They did a lot for me. I mean, for some people, it created some sort of histamine reaction, like a really bad histamine reaction. But I mean, I had moments of that, but it did help me in certain areas. And then I felt like I hit a plateau. And then I started doing my research on, mitochondria dysfunction and what I needed to do to rebuild my cells. And, I learned a lot about stem cell therapy. I started doing my research, and I opted to go get stem cell treatment in February of 2017. And I did stromal vascular fraction, which I went to a clinic for a couple weeks, and they did treatments on me. I did, different frequencies. I did biophoton therapy. I had IVs every day. They helped me with detox. I did 10 pass. I did ozone therapy, and then I had my stem cells. So then I went through liposuction procedure, which we all joke about it, that, for those of us that went through this process, the place where we went, we were only given like a numbing agent. So I had about I don't know how long of a needle that was put in my upper part of my hip, and they sucked the fat out. I ended up getting nerve damage there, and I do have a huge divot in my back, unfortunately. And the procedure for me was probably worse than going through childbirth. I will be straight up honest. It was the most horrific pain. I felt like I was outside in the woods and they put bark in my mouth and just somebody was stabbing me in the back. It was just horrible. But I went through it because I wanted to get stem cell. I ended up actually bleeding out, and I passed out in the bathroom in my hotel room. It was awful. It was an awful experience, but I was so thankful to be done with it and get my stem cells with the hope of rebuilding my body. I went home and went through what they wanted to call neurohealing. At this moment, I don't know if I necessarily believe in that process. I've got my own opinions and own thoughts about that. I dealt with a ton of neurological symptoms during that time, like beyond, it was agonizing. It was the most awful experience of my life. Like, just, the upheaval of cells in my body and my body reacting. And there were nights that I didn't sleep at all. I mean, we're talking days of straight up pure insomnia, no sleeping. I couldn't think straight. I couldn't eat. Some days I couldn't talk. I couldn't remember my kids' names. I was having memory lapses. I got to a point in 2017, in August, that I was suicidal. My brain inflammation was so bad that I really wanted to end my life. I tell people this story because I think it's important. What pulled me back from that absolutely horrific depth of hell was the thought of not emotionally coveting my children, and that I'm going to leave them with basically a legacy of not knowing, not getting tools to be able to deal with, major life issues. And I thought, I can't do that to them. I need to learn how to covet my own emotional health, and I need to find the tools, and I need to help them learn how to get those tools as well for themselves, so they can help deal with life issues that may come at them, So I thought it would be a very selfish thing if I did commit suicide. So that really kind of honestly pulled me back. And the weirdest thing happened was a random person had talked about the DNRS to me and said, I really think you need to look into this, because there might be something to the fact that our fight or flight is on fire. and I felt like there was nothing that I could do to self-soothe myself. I felt like I needed something. I was grasping at straws. And then the DNRS came to me, and I started the DNRS process and noticed that I made some shifts in my health. Very minor shifts. And I did the DNRS I did a lot of research too. I mean, I was looking at TED Talk, just like I did for bee venom and stem cell or any treatment or any detox modality. I researched, and read on the medical archives, anything that I could about rewiring or neuroplasticity. I watched TED Talks, I got books, I listened to audiobooks. I mean, I did everything that I could to surround myself and really understand what I'm dealing with. And it made sense to me because I, at the time, was dealing with, I got diagnosed with biotoxin illness. And they did a neuroquant on me, and my CT scan said 7 out of 8 PTSD, and also my amygdala had enlarged and my hippocampus had shrunk. And as we learn about brain retraining and the limbic system, that kind of goes in line with what I was dealing with. I was having some sort of issue with my limbic system, my CNS, my fight or flight, the center of my brain that deals with emotions, and also the other side of it was being rational. I was completely irrational, and everything for me kept coming back to that. So I started the DNRS process. I kept with it for about 12 to 14 months. I started doing mindfulness certification, became a mindfulness basically trainer. I got certification to go into schools and teach kids about mindfulness and like mindfulness practices. And then I noticed that I needed a little bit of something more. So then I started my research on Gupta. And then I started with the Meaning of Life app, and that was the first thing that I was like, oh yeah, I just maybe need to learn his system as well. And so I started that process of learning Gupta, and I started working with other brain retrainers, and we started sharing our experiences, and we started doing buddy rounds together. And I really felt like I made some significant steps in my healing. And so much that I started seeing a new practitioner, and she really believes in the limbic system impairment, and she's a big advocate for her patients getting on whatever brain retraining program that they can get their hands on. And so, and she said that's the utmost important thing if you're going to detox or do any sort of treatment, or you need to get your brain and your body back in line, to reconnect, and if you've been through PTSD, medical PTSD, to calm the limbic system down, calm the central nervous system down. That is only going to help your body purge these issues, these environmental toxins, get rid of the bacteria, get rid of these virals, get your immune system from being so hyper reactive, lessen your sensory issues, so much that I kept with it. And then I started doing more detox modalities, and then I started peptide therapy, and started doing things to help heal my gut. And I noticed I started gaining weight again. I started feeling better. I started having more energy. And I just felt like brain retraining was something that I needed to pursue, especially with dealing with medical PTSD. And so I started seeing a therapist, and we worked on trauma with, medical related issues. And we started doing EMDR, and then narrative therapy and exposure therapy and inner child work. And I just kept with it because, again, I can only see my therapist once a week, but I know that I have the tools with brain retraining to do this daily, to keep up with it, to help me rebuild my brain, help calm the fear center in my brain, to help, get my amygdala back to the normal size that it should be in my brain, to help my body's immune system calm down, to help my body detox better. The whole brain retraining process. It's a process. And, you know, I look at this as like when you're starting out as an infant. You're needing a lot of mothering and love, and you're crying out, and you don't know what you need. But as you brain retrain, all of that will get better. You'll build up your confidence, your inner child. You'll be your own self-motivator. You'll talk lovingly to yourself. You're going to notice that some of your its and your symptoms are going to get less over time. It's a process. And you just have to go slow, and keep in mind that you're starting out as an infant. Your brain is starting out like a little tiny baby, and you have to keep building up that confidence. You have to keep, finding ways to self-care and self-love, love your brain all over again, and get your brain to connect with your body. It's a process. But that's basically what my story is. It's been a long journey. I'm healing. I feel that brain retraining will be part of my life forever. I'm teaching my children how to brain rewire, because they may deal with circumstances or situations that might trigger things for themselves. So I think it's important that we get these tools and these techniques and share them with others. And I especially am passionate about sharing them with children and kids, because I'm finding that, medication is the first thing that people go to, when really it's all about addressing those fears that we have within ourselves, and really connecting those fears with our bodily functions, the processing that's going on in our bodies, and how these fears make such an impact on our overall health. And I think it's really important to start teaching children to recognizing these fears and addressing them, and learning how to process these issues. So then that way their body doesn't end up dealing with chronic illness or autoimmune diseases, or, just devastating things that can just really take a person down and change their entire life. But I just want to let you know, for those of you that are starting this process, it is a process, but you can get better. That's the one thing that I always wanted to hear from other people say, yes, you can get better. It was hope for me. And I would talk to therapists or friends, and they'd say, well, what do you need, Julie? And I would say, I just need you to tell me that it's going to be okay, and that I'm going to get better. And it gets me emotional, but you will get better. Trust me, you will. And it sucks for right now, but you will get better. You just have to hang on, self-care, self-mother, start the process, start brain retraining, believe that you have a limbic system issue, and that this is your answer. And once you get your brain to calm down, get it out of that fight or flight, the body can work better for you. It wants to do its best. It wants to do the best thing. Your body wants to work in the best way it possibly can to give you the best possible life. Believe it. Don't be against it. Don't fight against it. And that's the whole thing with brain retraining. We're working with our minds and our bodies to build our bodies back up after going through such a traumatic, experience in our lives. So I'm so glad you're joining me on this journey. And please, please reach out to me if you have any questions. I will post more about brain retraining, starting the process. I will share my experiences. I will do rounds here on my YouTube channel. I'm so excited. That way you can get access to my rounds. And if you know me on IG, please feel free to reach out if you want a buddy to work with. I love sharing my rounds through IG Messenger. And it's just a great way to connect, and we're all on the same page, and we're all helping each other. We're staying focused, we're sharing. We need a tribe. It's really what's happening anymore, is that we're so disconnected in general in life. We need a tribe of people that, that support and love us and want to covet our emotional health and help all of us learn how to do that together. So I'm just so happy that you started your journey with brain retraining, and I'm so glad that I'm here being able to share my experiences and do these rounds, because it's really, I'm being selfish. I'm doing these rounds for myself, for accountability, and I love talking about it, and I love, doing these rounds. It takes me away, and and it helps center me, and I just feel my energy shift after I do a round. It's so empowering. So I won't keep you, but thank you for joining me. Please subscribe and tune in. I'll post more videos, and we'll go on this journey together. You're gonna get better. Believe me, trust me. I was a hot mess, and I'm still healing. I'm still moving forward in my healing journey, but I'm so much better. Oh my gosh, so much better. So believe that you can heal. Believe it. Build that inner confidence up, that inner child up, and love her or him, and be your own coach. Keep at it. Keep brain retraining, and thank you for tuning in. Talk to y'all soon. Biggest hugs.